Sleep problems like insomnia or reduced sleep, excessive sleep, snoring, sleep apnea, etc. should be considered as symptoms of diseases rather than a disease. Lack of sleep or excessive sleep are the signs that the brain or nerves have been affected. Snoring is the symptom of restriction in breathing during sleep. The brief stoppage in breathing while sleep is called sleep apnea. The cells of the body are active even during sleep, and this requires continuous pumping of the heart and blood circulation. During sleep, the immune system generally focuses on repair activities. If proper sleep is not available, the repair work are not properly done. Mental and physical health gets affected. Current health problems become aggravated, and as immunity is compromised, the chance of developing new diseases also increases. Though medications are available for insomnia and excessive sleep, their repeated usage often results in many side effects. Development of addiction to these medicines and loss of effectiveness over time. Lifestyle diseases like obesity, excessive abdominal fat, diabetes type 2, hypertension, cardiovascular disease, mental ill health, allergies, asthma, acidity, autoimmune disorders, cancers, etc. negatively affect sleep. Let us see how with lifestyle correction it is possible to overcome sleep disorders and reduce excessive medication dependence. Health tips are not the focus here. Rather, the effort is on providing information that will help you to understand the causative factors behind this disease, measures for early detection, investigations to assess the impact of disease on different parts of the body, available treatment options in modern medicine with their benefits and limitations. The goal is to help you understand the relationship between the disease and the lifestyle factors. More importantly, to understand the impact of lifestyle correction on reversing the disease process and preventing recurrence. Those who are on medication should remember to reduce or stop medicines only under medical supervision. Next, we will see what are the major sleep disorders. Insomnia or decreased sleep is the most common. And next is snoring and sleep apnea. And restless leg syndrome also can affect the sleep negatively. And another thing is teeth grinding or bruxism. That is very common in children. Even in adults also it can occur. Next is hypersomnia, that is excessive sleep. The lack of night sleep itself can present as the daytime dosing of and excess sleepiness. And another major disease affected by showing this sleepiness is narcolepsy. That is actually an autoimmune disease which is affecting the brain, a special part of the brain of the hypothalamus, which the special cells are there which secretes orexin, which is a stimulant chemical for the brain, and the secretion of the orexin if reduced, you may feel sleepy. And in this narcolepsy disease, this orexin producing cells are destroyed, just like pancreatic islet cells in the type 1 diabetes. These are destroyed, and the patient, it is a very difficult condition actually. It's a very difficult to treat also. I'm not going into the details of that. We'll be discussing only the common and usual day-to-day life, the common type of sleep disorders. Another thing is sleeping sickness or infection that is produced by a bacteria that is also seen in mainly in African countries. We are not, that is because of it's an infection, it has medications also. We are not going to the details of the disease also. Next, when we consider the sleep, we should have an understanding about the basic pattern of sleep. What is sleep actually? According to the modern understanding, sleep has two major aspects. That is, one is non-REM sleep and REM sleep. That is, REM means rapid eye movement. During the sleep, when the eyes are moving rapidly from side to side, it is called REM sleep. And if it is not, movement is not there, it is called a non-REM sleep. Actually, when you sleep, you first go into the non-REM sleep, and it itself has 3 stages, and initially, and then it is more lighter, more deeper, and then again more deeper. And in the fourth phase, actually, this REM sleep is actually the fourth phase, and in that the eyes are moving, and usually this is the time when you are dreaming. Usually, when you sit in the sleep, it will take around 90 minutes to go into the REM sleep. Actually, then what is a normal sleep pattern? That we should also understand about that. Basically, now after the electricity, our sleep pattern is changed a lot. And before that itself, there was gas, this kerosene and gas lighting, etc. was there. But with the electricity, household electricity, it is all the time we have electricity and light is there. Otherwise, only the sun was we are depending on the light for the sun only. So, according to the studies of the olden literature and all, generally the people used to sleep as a biphasic sleep pattern. Usually, even though you go to sleep around 2 o'clock or 3 o'clock, people get up. And in Western world, there is especially UK and all, they call it watch time, and they get up and do some household activities and all. Then again go to sleep and get up by the sunrise. In India, we all know that this Brahma Muhurtam, there also around 3 o'clock we get up and say our prayers or meditation and yoga. Such activities was very common in olden days. Now also, because especially the spiritual people, those who are trying to understand more about the nature and the life, etc., they also find this time most auspicious and spend for meditation and other activities. So generally, people always, patients also say that I'm getting it at 2 o'clock and 3 o'clock or 4 o'clock time, but then I'm not able to go to sleep for a long time. So the everyone should understand that this waking up at around 2 o'clock or 3, around this 3 o'clock time it's a natural rhythm. That is, it's a biological clock in us itself. If you go to sleep at 9 o'clock or 10 o'clock, it is very natural, and even your bladder, the natural call, the bladder may be full, and you may have the feeling to pass urine. That itself will make you get up. So just getting up at 3 o'clock and not getting sleep for some time, don't take it as sleeplessness. So take it as a natural thing, especially when you are old age, after 50 or 60 years or 70 years, it will be very natural. And take it that it is time to you should start going spiritual. More importance to spiritual life and such things. So take it as an opportunity, and take it as a reminder. Next is how much time we have to sleep. Generally, the children, when you are a child, you have to sleep around the baby, because that is the natural rhythm. If you are don't disturbing, usually small babies we don't disturb, and they will sleep for 16 to 18 hours. So more sleep is needed for them, because it is the development, brain development and all is happening. So the more sleep is needed. When the children is growing up, the need for more sleep will be reduced. Even that time also they need at least 10 hours of sleep, especially during the teenage growth time. That when you are sleeping, this growth hormone, and so the brain is actually, even the immune, this hormonal system, brain is actually controlling all the hormones in the body. And there is a pituitary pineal gland that is a higher rest, then hypothalamus is there, then pituitary is there. So these are the control, they are producing controlling hormones actually. So this growth hormone is produced by the hypothalamus, and it is also growth hormone actually that is produced by the pituitary, and there is a growth hormone releasing factors, that is another type of hormone which is produced by the hypothalamus. So all these controlling mechanisms will properly function only when you are getting good sleep. So for the children, especially in the teenage age also, is very important. Then when we come to the old age, actually the sleep inducing hormone is the melatonin that is produced by the pituitary gland. When if the pituitary gland is the cells are reducing in number because of the old age, or even the degenerative brain disorder of the brain, disorders like Alzheimer's disease or Parkinson's disease, and when you sit with old age dementia, there is a general weakening of the neurons, and naturally the pineal glands also can be affected. That is one of the reasons for the old age. The more common is sleep reduction is or insomnia is more common in the elderly people. When we come to the symptoms of sleep, definitely we can say that either excess sleep or less sleep. But usually if you are not sleeping at night, daytime drowsiness can be there. And also irritability, and you won't be able to focus because if you are not getting enough sleep, the brain cells are not getting rest, then you won't be able to remember much of the things. So that when you are saying or remembering anything, and there is some certain type of changes happening in the nucleus of the cell itself. Even actually there is DNA and epigenetic changes, and so many chemical reactions are happening for this storage of memory and cognition, everything. So those things are not properly, because of the lack of rest, these things cannot be done properly. That is the reason why you will be lack of focus and irritability and all. When you externally, if you can do any symptoms, if this sleep apnea, if you are long-term sleep apnea and they're not using any CPAP or anything, then even the extremities can get darkened. And I have seen the patient with a very dark extremities, that is foot and palm get darkened because the circulation is not coming, because that are the extremities, so blood is not reaching there. That is the reason for that. That is very rare, only in the extreme cases that happens. Then next is how you can diagnose this problems, sleep problems. How can you diagnose? You can, if you are able to record your sleep with a webcam or something, you can simply see that what are you doing with while you are sleeping, whether you are getting enough sleep or snoring is there. So those things one can assess by themselves, or you can, if the husband or wife or children, if someone is sleeping with you, definitely they will be able to, but they will be also snoring, they will be able to understand, but they will be also sleeping, so you won't be able to make it. So easy thing for, because it is webcams are so common now, we can do that. But as a professionally, in a medical field, how we can diagnose sleeping irregularities is PSG, that is polysomnography, which is actually conducted in a special sleep lab actually, which has some different facilities actually, in that monitoring different aspects of the body functions during that time. One is EEG, that is electroencephalography, that is the recording of the brain pattern, brain waves. Then EOG, that is electrooculography, that is eye movements is recording. And EMG, that is electromyography, that is mainly connected to the chin muscles and also the leg muscles to see any bruxism or teeth grinding, and also the restless leg syndrome will be able to diagnose. Then is ECG, that is heart electrocardiogram. And also there is definitely audio-visual recording of the whole person. It is what is happening in the sound, snoring is there, or this audio-visual recording will be there. And also the nasal sensors and the throat sensors is inserted into to see the airflow movements and how much it is affected. That is mainly for the sleep apnea and the snoring aspect more scientifically assessed. And then breathing pressure monitoring, that is by special sensing belts are applied on the chest and abdomen. And oximetry, that is oxygenation, to see the oxygenation of the blood by using the pulse oximeter, the Thomson. So many, so for in a sleep study, so many parameters are studied, but basically this all will be able to know what it is, but it is not a treatment. That we also should understand that nowadays the sleep itself becoming a specialty, so the diagnostic part is that, but we should understand that Actually, basically, it's a sleep is only a symptom of underlying disease. So, what next when we consider what is the pathology with this sleep irregularity or sleep disorder? What is the pathology? Which part of the body is getting affected? Basically, the whole when the sleep is affected, the whole body is affected. But primarily, the sleep is the induced and maintained, and everything is by the brain. So, if the sleep is not happening properly, that means your brain is affected. The brain cells are affected. We know that if you get a joint pain or a wound, you get pain on the skin, or even arthritis, you get pain in the joints. So for the brain, the problem is brain is not that sensitive. There is not much sensory pain sensors in the brain cells. Brain matter actually, the problems of the diseases of the brain. But what you are getting, the sleeplessness or your behavior abnormality, that is actually the psychiatric disorders, all this schizophrenia, psychosis or bipolar disease, all these are actually affecting the brain and brain mechanisms, and the brain chemicals are affected. So just like that, this sleep also is a problem with the activities of the brain cells, and usually the psychiatric patients all will be having this problem, and they will be given medication which is either stimulant or depressant. So they will be finding it difficult because both is interacting also. Next, what type of patients get this sort of sleep problems? Usually this insomnia is produced mainly by some other disorders or even the excessive sleep. That also is a sign of other diseases. Like diabetes, hypertension, or gastrointestinal problems like GERD. So this is actually just like pain. This is also a symptom. You should consider it like that. And also this problem can arise because of the medications taken for the diseases itself. This if you are taking this aspirin, clopidogrel, or this anti-blood thinners, if you are eating and going to sleep, you may not be able to get sleep. Even many of the diabetic medicines they produce gastric irritation, so it can the sleep will be affected. And definitely, if this is anything which is producing pain, you won't be able to sleep properly. Next, another thing is obesity. This patients with sleep apnea is mainly because of this obesity. That is, obesity means there is a lot of fat accumulating around the throat, especially the air passages, and the muscles will be weak also for many of them. Because of this, when the fat is accumulating even into the muscle cells, the muscles which is holding this respiratory tract will be weak, and there will be so much of the fat. So that is the reason for the snoring and the sleep apnea. Most of these patients, especially obese patients with a short neck, so the increasing the size of the neck also is predisposing the person for snoring and sleep apnea. Then another thing is allergies. And tonsils, enlarged tonsils, usually the allergic patients get allergy, and allergy predisposes to get infection. And when the infection of the tonsils and the adenoids, especially adenoids, is very prominent in children, and if you are getting repeated allergies and repeated infections, the adenoids will be enlarged. That will also make a difficulty in breathing. Then the allergies can even this nasal block or the deviated nasal septum. Actually, this deviated nasal septum is not the reason for this block. Actually, it is the allergies which is producing. Even if there is a slight deviation of the nasal septum, it will not affect your breathing. Actually, only when there is allergy also set in, it will become a problem. Then next is the use of this recreational drugs like alcohol, smoking. When you are using smoke, definitely it will because it is a stimulant. If you are sleeping in the later hours of the day, you will not be able to sleep. And alcohol, we generally think that many people take it is comfortable to sleep after taking an alcohol, but it is a brain suppressant, so it can improve your sleep. You feel like you're sleeping, but the problem is if you are obese and if you're having snoring and you are having sleep apnea, then because it is a sedation for the brain, the problem with the sleep apnea and the snoring can be increased because your alertness of the brain is needed for keeping the airway open. So if you are having this problem and you are using alcohol, the problem can be exaggerated. And next is any problem with the pain, you won't be able to sleep, and also stress. If you are mentally stressed because of the family problem or job problem, you won't be able to. That is also a major. Stress is one of the major factor for the sleeplessness. So you should find the solutions and try to relax. And next is medications. Many medications can stimulate, even the hypertension medicines, most of the medicines can create problems with the sleep. And one of the reasons is actually gastric irritation. If you are taking the medicine and going to sleep, it can lead to lack of disturbed sleep. Next, you will see what is the treatment options for the sleep problems. Basically, first is the lifestyle correction, that is sleep hygiene. Because of the electricity and all the screen time, that is first electricity came, then the TV came, then computers, and now the smartphone is there. So we will be spending so much of time with the screen. So we will be able to sleep only if the darkness comes. That is the nature's role. When the darkness comes, this pineal gland secretes this melatonin, and that is actually inducing sleep. So when you are always looking into with the light is there and you are working on the computer, so light is there, so you won't get this melatonin will not be coming out and you won't be able to sleep properly. So first thing we have to do is, if you are having sleep problem, see that you are going at a regular time for the sleep. For example, 10 o'clock you go to sleep and get up at 6 o'clock. That may be an ideal, but it may not be possible for everyone because of their job and now the night shift, and many will be working at the night. But whatever be the timing, you should find out a regular time for your sleep. And do not take at least 6 hours before this caffeine and this tobacco and all these stimulant beverages and all you should not take before going for sleep, at least 6 hours before. So almost this nicotine and the caffeine and everything will act around the 6 hours. So if you have sleep problem, don't take all these things. Even tea, coffee, everything you should avoid. And also don't go to sleep with a heavy stomach also. It's always go to sleep, it is always better at least 2 hours before you take your dinner, before 2 hours preferably. Because if you are going immediately after the food, the regurgitation, the stomach will be full and the fluid will come up and it will irritate your respiratory passages, and you may not be knowing that you are getting irritated in the respiratory passages because the sensation is there is not much pain senses and all. So you will be uncomfortable and you will be getting up and of the cough or something like that. Next is weight reduction. If you are having snoring or sleep apnea, the most important thing what you want is reduce the excess fat in your body and strengthen your muscles. And it is applicable it's important for the throat muscles, tongue, the special movements for the tongue and the throat exercises is very important for reducing the fat and strengthening the muscles of the throat. That is very important to overcome this sleep apnea and snoring problems. Then medication. Actually, if you are using sedatives for all the medicines which we are using for this sleep-inducing medicines are sedative, but the hangover will be there in the daytime. So if you are using sedatives, you will be sleeping excessively or your alertness will be reduced in the daytime. So we should see that if you have a problem, you should be at least you will be taking medicines only if you are having a problem, but you should be aware of that also. Especially if you have sedatives, even this cough syrups and this cold medicines and all will be having sedative type of nature will be there. So if you are driving in in the morning after all these medicines, the chance of getting accident or sleepiness because of the sleepiness will be high. Then another most important thing is most of these problems are lifestyle diseases. So reversing the lifestyle disease is very crucial. Yes, you will be taking all these medicines like aspirin, clopidogrel, diabetic medicines, and taking insulin injection. And if you are taking insulin injection in evening and night, you are sleeping. If you are hypoglycemia, your brain will be disturbed and the sleep will be disturbed. And if it is very severe hypoglycemia, you can go into unconsciousness and sleep. The problem is bigger actually. Even hypoglycemia is more problematic than the hyperglycemia. So we should understand that all these problems are because lifestyle diseases. You are not getting enough sleep not because you are not taking medicine. It is because of a disease you are getting the sleeplessness. So most of these diseases which is giving you this sleeplessness, including psychiatric problems, diabetes, hypertension, heart disease, gastrointestinal problems, GERD, everything is they comes under the category of lifestyle diseases. If you are able to correct the lifestyle, you will be able to get out of these problems, not only from the sleep problem, others also. Next, what are there are some appliances are there for orthopedic appliances and dental applications. That is mainly for the sleep apnea and snoring problems. And some mandibular advancements, splints are there. That is some are dental specialist will give, that's orthopedics, orthodontic surgeons. And next is this most commonly and the most effectively used is CPAP machine. Actually, CPAP machine is giving positive airway pressure actually. So it is with the pressure, it is actually keeping your throat open during sleep. The problem with the sleep apnea is your throat is closing during the sleep. So it's a type of minor type of artificial respiration. It is used. But the problem with this, many people will not be able to sleep with this because you have to put a mask and some bands will be put on the face. And so it is because of this difficulty, many will not be able to get a proper sleep. So even though doctors say use it even if your palm or the sole are darkening and so much of problem, you are not able to concentrate. If those problems are there, but your doctor asks you, but you are not able to go to sleep with these machines and on. Then what is the next options is the medication. For the sleep apnea, no medicine can help you with the sleep apnea. But the other insomnia, you will be able to, there are sedatives and hypnotics. That is a group of medicine. And it is basically, all these medicines are acting on the brain. And most of these medicines is mainly as a psychiatric medicines comes. But for the sleep psychiatric patients, the sedation will be very essential for that purpose, and also for the sleep it is used. Next is melatonin, that is a sleep-inducing hormone itself. That doesn't have comparatively safer, and also it doesn't have much of this after sedation effect will not be there. You'll be able to sleep for a time, but when you get up, you'll be alert. But all these other sedatives and hypnotic medicines like benzodiazepines, very common, zolpidem, and so many medicines are there. So those will be, the hangover will be there, but melatonin, that won't be there. But another newer medicine, the latest addition is one of this melatonin agonist is there. That's an artificial form of melatonin. And orexin antagonist, that is orexin is the thing which is keeping you alert. And there is one new medicine which is actually, it is blocking this orexin and keeping you allowing you to sleep. This all the latest, that is new medicines, and is very costly also. It is not available in many countries. Then for the those who are having excessive sleep, stimulants are being given. And even if you have nasal blocks because of allergy and all, you can use the nasal drops or spray there, and also allergy medicines, which keeps your this inflammation in the nose and edema can be reduced. So you'll be able to take breath properly and you'll be able to sleep. Next is there any surgical options for the sleep problems? Basically, the sleep sleep apnea, that is especially the obstructive sleep apnea, that is really it's a structural problem with the air passages. In that, some sort of surgeries are there, but that is not that effective, even though uvulopalatopharyngoplasty, that is actually when you open the mouth you can see this dropping small bell-like thing that is called uvula, and that part and the soft palate and the pharynx, especially the adenoids, some part of the adenoids and removed, and these sort of surgeries are there. The problem with that is actually you're not constructing anything. There is an obstruction, so you are removing some part of the throat itself. Actually, the problem is the excess fat. You won't be able to remove the excess fat. So that surgery can, if you are removing, so there is a repair chances also will be reduced. So you should take all the lifestyle corrections and correct it. You can easily correct with the lifestyle correction, but if you do the operation, if the scarring happens, so it will be very difficult to correct it later. Then the latest, there is some radio frequency ablation techniques are also, so applying some probes into the throat and heating it to around 77 to 85 degrees centigrade and destroying some part of it. And it is all in the trial, and some hospitals and all may be doing it also. And there are few centers that are giving some laser treatment, that's also using laser probes and heating actually. So there are different temperature, and it is used for some regeneration or helping this sort of thing, but it is not that effective. So not much data is also available on this treatment success and all. Then another thing is pillar procedures, that is track-on sticks. Basically some type of plastic sticks are applied in the soft palate and keeping it stiffened so that it will not relax and go to and block the throat. Then next procedures are actually tonsillectomy. If there is a obstruction, tonsils are encouraged to remove it, and it's adenoidectomy. That is also if the adenoids, there is then the throat in the back, and it is more developed and more prominent in children. So for the children, this tonsillectomy and adenoidectomy, it's not done in children and also for the adult also. But adenoids are more prominent in children. Usually adenoidectomy is done for the children actually. So but the problem is that these tonsils and adenoids are act as our defense stations. Actually they are guarding our three guarding stations actually to protect you from this all the bacteria, viruses and all. If you are removing the tonsil or adenoids, tonsillitis will not come and adenoiditis will not come. But the problem is you can get respiratory pneumonia and all respiratory tract infection. The chance will be very high. And also this tonsils and the adenoids is screening what you're eating also. So that also will be getting affected. So we should, before removing tonsil and adenoid, we should think many times, because especially it is so commonly done in children. 2 years, 3 years and all, adenoidectomy and tonsillectomy is done very commonly. So actually the children is getting all these diseases that is obstructing, and the tonsils or the adenoids are enlarged, and the repeated infection is because of the allergy, the food which is you are giving the child. All this junk food with the chemicals, colors and preservatives, all these food additives, it is actually creating an allergic reaction initially. If you notice also, you can see that the child will be getting a fever or the respiratory throat pain after taking some ice cream or some this soft drinks or the artificial juice or the chocolates and things like that. And after slight throat pain, then nasal congestion, nasal block, then go to fever. And finally, you may have to give a course of antibiotics to the child. And after recovery, again the child is eating or given by someone all this junk food, and again. So this process is going on, and multiple times this is happening. Then the tonsils and adenoids are hypertrophied and blocking even the airway. Now we have discussed about the medicines and surgery and options. And what are the limitations? What we can understand is actually for the sleeplessness or excessive sleep, medicine is only stimulant, or either it is stimulating the brain or depressing the brain. All these sedatives or the sleeping pills are actually depressing the brain. So the next day the sleepiness, the hangover will be there. So the other problem, actually excessive sleep and sedation will be there. And also the medications can give you this addiction, because any medicine which is acting on the brain can have an addictive tendency also. So you become dependent on the medicine. So the problem with the medicine use is you should restrict its use for a short time. If you have a mental stress or a problem, immediately for 1 or 2 days it is good. You can, there are good combinations of medications which or simple medicine itself, you can have a very good even dreamless sleep that will be very refreshing for many. But the problem is just like alcohol and smoking and all the things which is affecting the brain, it is having an addiction, and everyone like a good sleep. So you will be having an interest in taking the tablet or again and again. So you will dependent on that, and also after some time you may not get the sleep with the same dose. So you have to increase the dose. Then it will be finding it difficult to come out of this. So it is only a short time you can use it, medication for the sleep. So what we can, and even the surgery, it's all damaging only if you are either you are removing the tonsils or adenoids, that is your immune system organs itself, or you are doing some part of this soft palate, uvula or pharynx or whatever organs what you already have. You, even though we can remove, the surgeon can remove, but we cannot replace it with anything. Once it is removed, it is you are losing it. So when you are doing surgery also, we should always remember that. So most of these problems can be solved with lifestyle correct modulation, and should avoid. And also the medicine also, long term medication is not a solution. Then what is the real solution for this lifestyle problem, this sleep problems? So basically we should understand that the root cause is some disease which is creating. So if you are not getting sleep, or you have feeling excessive sleep, you should find out the cause. It may be you may be having a sleep apnea, or if you maybe you are diabetic or hypertensive, or you may be having a heart disease or gastrointestinal problems, which may be creating this disease. Or the medicines, you are already diagnosed with the diabetes, hypertension, and you may be having on medication, and maybe this medication is creating trouble for you. And I have seen so many patients who are not able to sleep. They are before going to sleep, they will be taking 4 or 5 medicines, and including this acidity making medicines like this blood thinners, aspirin, clopidogrel, and this metformin for the diabetes, and all this they will be taking and going to sleep, and they will not be able to, because of the stomach discomfort itself, won't be able to get sleep. And many lifestyle factors, the lifestyle factors like not you are spending too much of time on the screen and not having a regular sleep pattern. So you have to correct all these lifestyle factors first, and you have to try to come out of lifestyle diseases itself. If you are able to reduce 10 or 15 kg, especially for those who are overweight people, most of these people coming with sleep problem will be overweight. At least they are having abdominal obesity will be there, visceral fat will be high. So if you are able to remove that excess fat from your body, then your breathing and the sleep pattern will be regularized, and also you will be able to come out of many of the diseases like diabetes, hypertension, etc. Then how you should do a lifestyle correction? Definitely everyone knows that healthy food, if you are overweight, low calorie diet, especially carbohydrate and saturated fat should be reduced, and stick on to more leafy vegetables. Actually leafy vegetables, green leafy vegetables are rich in vitamins and minerals, and other vegetables and fruits, and the pulses. And if you are non-vegetarian, you can have some non-veg items also. If you are overweight, especially, or excess fat or visceral fat or the abdominal obesity is there, always cut on this calorie, and see that taking nutritious food only, and avoid this color preservatives food, the food with the additives also, and see that you are getting enough nutrition, and also the exercise, and do basic exercise. And if you have sleep apnea, do some neck exercises and throat exercises, and that will be fine. And if you're not able to get a relief with self lifestyle correction, then you can think of getting some support, clinically supported lifestyle correction, so that you will get support for the nutrition and also the correct method of exercising and all. And this, if a person who's having only some snoring or light problems, you can go for the exercise and you can correct it. But if you're taking so many medicines, and if you are heart patient or diabetic or hypertensive, you won't be able to stop the medicines, and if you are continuing, you have to take the medicine, then you won't be able to do it by yourself. Then also you need a clinically supported lifestyle correction. In short, insomnia, excessive sleep, snoring, sleep apnea, etc. may be a result of disease affecting the body and even medications being taken for their treatment. Lifestyle diseases like obesity, excessive abdominal fat, diabetes type 2, hypertension, cardiovascular disease, mental ill health, allergies, asthma, acidity, autoimmune disorders, cancers, etc. negatively affect sleep health. Many medications taken to treat such diseases create side effects which cause discomfort, fatigue, and negatively impact sleep. When the deficiencies in lifestyle, which is the underlying cause of such diseases, are identified and corrected, it is possible to not only overcome the sleep problems but also simultaneously overcome a range of lifestyle diseases and also the medication needed to treat them. Next, let us understand what is clinically supported and supervised lifestyle correction. In this, the first step is to understand your body parameters by assessing body composition, the lean mass fat mass ratio, body age, fat status, etc. Second step is to evaluate the current status of your organs like heart, blood vessels, liver, kidney, pancreas, hormones, immune system, toxin level, nutritional status, etc. And also to find out the most suitable food for your body and what to avoid. Third step is to identify what lifestyle modulations can help achieve a reversal of disease process, attain desired body composition, and normalize blood parameters. Based on the patient parameters, efforts is directed to provide optimum nutrition, physical activity, and reduce toxin level. The focus is to create an enabling environment to balance the metabolic activities at cellular level. In most patients, even those on medication for many years or advised surgery for lifestyle diseases like diabetes, hypertension, heart disease, arthritis, autoimmune diseases, cancer, allergies, etc., can prevent progression of the disease to some extent, reverse the damages, and come out of most of the medications within a month and avoid surgeries, provided the patient is able to correct lifestyle before the organs are irreversibly damaged. Next, let us see the changes in the disease condition of patients who have undergone clinically supported lifestyle correction. I will give this patient, actually he's a male, 48 years, and his height is 165 centimeters and the weight is 95 kg. And he is on CPAP for the last 15 years. He wanted to know whether he is able to come out of this. And he had some other health issues like allergy and fatty liver. And with the investigations, I'm not going into the details of his other health problems. And with the clinically supported lifestyle correction, in the first month itself, he is able to come down his weight from 95 to 82. So actually, he was so comfortable with by the first month itself, and by the second month, he is able to come down again below, say, around 78 kg. By the time he is able to remove his, he is able to sleep without the CPAP machine itself. So he is having other problems like allergy, cholesterol, dyslipidemia and all, those things, and he was taking statin and allergic medicines and all. He was not able to come out of all this statin and allergic medicines from the first month itself. And by the second month, he is able to, end of the second month, he is able to come out of CPAP machine. And by third month, he was able to come down to around, his weight was reduced from 95 to 79 actually. So he was so comfortable. So what we should understand that if a person with sleep apnea and who is on CPAP machine and all, if they are willing to do the lifestyle correction, they can come out of the obesity and then come out of the this sleep apnea and CPAP machine also. And along with that, if they have some other problems also, some other lifestyle problems like diabetes or hypertension, whatever is there, you can come out of that lifestyle problems, diseases also. And usually if it is a person with diabetes, if type 2 diabetes, before starting the lifestyle correction itself, we stop the diabetic medicines and check it is within 24 to 48 hours the diabetes blood sugar will be controlled without medicine itself. And most of this hypertension, heart disease medicine and all, within a month we can come out of those medicines. Especially for this metabolic syndrome, is very easy to correct actually. Only thing, the patient should have the willingness for correcting the lifestyle. And for many people, they will not be able to, they don't know what is the correct lifestyle and how to correct it. And there you need the support also. We'll discuss one more patient. This is a male who is 65 years and his height is 175 centimeters and weight is 65 kg. He is not overweight or anything. And his major problem is actually sleep problem is there. And along with that, he has been advised for a bypass surgery for the heart problem. And he is having leg pain, this restless leg syndrome. Actually, this restless leg syndrome was because of the atherosclerosis. On his Doppler studies, there is plaques formation in the leg and also in the this carotid arteries also is affected. And usually if there is atherosclerosis there, almost all the part, for the heart angiogram is looking into the coronary arteries. If the coronary arteries are having block, that means your arteries to the brain also, that is carotid arteries, can be affected. And if those patients who's having a leg pain and all, means that is the leg also is affected. So he is having a generalized atherosclerosis there and advised for the bypass surgery for the problem, and he is having little sleep and digestive problems, and usually the patients coming will be having multiple problems. And what was actually, he was taking so many medicines, clopidogrel, and this aspirin, clopidogrel, rosuvastatin, 40 milligram he was taking, and he is taking this termisatan, that is for the BP, and this gastric problems is taking Pantop and Nebigard, another BP medicine. So he's on multiple medication, and the problem is, major problem, he wanted to get out of this bypass surgery, and he wanted to definitely, if correcting the BP also, this sleep also is important. So actually by the 15th day itself, he was able to, in the third week itself, he is able to come out of all the medicines, and his BP is totally controlled. Actually, even with the medication, his BP was 140/90. But by the second month, first month itself, his BP is 120/70 without any medicine. The sleeping is got corrected. Usually we don't use this hypnotics and medications. Even the patient is to get good sleep for a few days, melatonin, sort of the hormone replacement will be given. And that is not as a sleeping pill, it is to regularize. Only thing, the patient, if you are using that, has to regularly go to sleep and avoid this stimulant beverages, coffee, tea, and etc. And the smoking has to be avoided, and go to bed at a regular timing. And for the initial few days, person can take this melatonin to regularize and then come out of it. within a week or 10 days we stop the or 1 or 2 weeks according to the patient need, and then come out of the medication also. This that is melatonin is a hormone. That is actually, it's not a drug, it is a hormone, but it also has to be used only for a short time. Otherwise your brain cells which is producing melatonin will get suppressed, and you won't that you will get dependent on the this external supply. So both these patients' experience shows that if you are willing to do a lifestyle correction, you can come out of a sleep problem, and also you can avoid the CPAP machine, and you can come out of CPAP machine, and also you can avoid a bypass surgery. It's a major surgery. You are actually opening your thoracic cage and doing multiple connecting your heart to a heart lung machine and doing a major operation. So it itself can, especially when you are doing it in a senior citizen, like you are in 60s or 70s, so much of problems can arise because of the surgery itself. So all these things, and probably you can come out of the surgery, you can come out of medication also. Yeah. Even if you go for a bypass surgery, you have to continue all these medicines, and if you are taking all these medicines, this medicine will itself will make your sleep disturbed. Even this telmisartan sort of this anti-BP medicines can if you are taking a medicine, you should always read the side effects and the drug interaction, etc., so that you will be able to find out which medicine is actually creating trouble for you. And all the medicines which is producing acidity can produce sleep disturbances also. Here in clinically supervised and supported lifestyle correction, what we are trying to do is use the healing power of the body by empowering the healing aspect and anti-inflammatory aspect of the immune system. First is by providing optimal nutrition. Second, by promoting removal of toxins by improving circulation through optimal stimulation of all cells by planned exercise. Third, minimizing toxins entering the body through food, water, air, and cosmetics. Diabetes, hypertension, heart disease, cancer, liver disease, kidney disease, obesity, stroke, allergies, autoimmune diseases, etc., comes under the umbrella of lifestyle diseases. 90% of the medication and 90% of the surgeries are for lifestyle diseases. This means that 90% of the medicine and 90% of the surgeries can be avoided. It is good to understand that neither medicine nor surgery can cure a lifestyle disease. To put it differently, it is not a lack of medication nor surgery that created the disease. This is why once medication is started, very often both the disease and medicines will keep on adding more numbers along with the unwanted side effects. This is why it's very important for you to understand and correct the lifestyle while also encouraging others to do so. Another important aspect is when someone is talking about healthcare and treatment approaches, you should consider the scientific background of the concerned person. I am Dr. Thomson, started medical education in Government Medical College, Kottayam as 1981 batch, and completed diploma and MD in obstetrics and gynecology from Government Medical College, Thiruvananthapuram, Kerala, India in 1992. After additional training in reproductive medicine and surgery, joined government service, later resigned from the government service, and in 1997 started practicing as consultant at Life Care Center, Tevara, Kochi, focusing on lifestyle modulation with the clinical support for lifestyle diseases, minimizing the need for medication and surgery. Another important thing every patient should understand is a patient's role in drug pollution. Major part of the medication we take are excreted in urine, sweat, and stool. It will reach the groundwater, rivers, drinking water, plants, animals, and food products. That means the medication we take is becoming a threat not only to us humans but also to all the life forms on our planet. Therefore, it is essential to correct lifestyle, reverse lifestyle disease, and come out of medication. To protect our children, grandchildren, and the coming generations from the ill effect of the toxic pharmaceutical pollution, we should come out of the dependence on medication. The current norm of chronic patients on lifelong medications has to change. Spreading awareness on reversing lifestyle disease and minimizing medication is the need of the hour. Therefore, remember to share this to your relatives, friends, and colleagues who are on chronic medication or planning for surgery or lifestyle disease. The last few decades of modern medical management clearly shows that medication and surgery cannot cure most lifestyle diseases. Reliable and sustainable solution lies in lifestyle modulation. To know more about the different lifestyle diseases, treatment options, reversal of lifestyle diseases with the clinically supported lifestyle correction, etc., you may visit our YouTube care channel. Thank you.